that there were levels of this dimension, which I'm sure we'll talk about. But one major aim has been achieved.
Yeah. So there's a lot of terms that people have gotten to know in the last couple of weeks. Talking about social distancing, of course. Flattening the curve. That's a very interesting phrase that a lot of people are now trying to understand. And I think it's what this lockdown is supposed to help a lot of countries do. I'm talking of Nigeria in particular now, where we're probably getting to a peak with the numbers of infections, and hopefully we start to flatten the curve after that. How far away are we, do you think, from this peak in Nigeria?
Yeah, so I think that really is the question, isn't it?
Yeah.
What is clear about this outbreak so far? Well, there are stages of an outbreak. Let me so that people can understand what we're talking about. So there's the initial stage where you have a few cases. The aim at that time is to contain it, get all of them together and make sure it doesn't go into the community. Once it does get into the community, as much as possible, you want to slow down the number of people that get infection at once.
Yeah.
This is what overwhelms health systems. If everybody gets at the same time, it's going to be tough to deal with. So what you want to do is make sure that you reduce the number of people that have this infection per time. This is what this lockdown is supposed to do.
Yeah.
We know that there are infections going on in the community.
Yeah.
So what you want to do is keep people as much as possible apart from each other, so that those that have an infection will, recover. That's what it means to flatten the curve. Flattening the curve on one part means reducing the number of people who have the infection at once. It's not so high.
Yeah.
But then, what flattening the curve, if you look at the curves, if everybody gets the infection at once, everybody gets sick at the same time, and we recover whichever way it is. But if you slow down, everybody may still get, a lot of people may still get infection, but it will take longer to clear. But at least you have a manageable amount of people getting infection per time. That way, health systems can cope.
I asked that because there's a lot of beliefs and rumors that keep flying around, especially in Nigeria. I'm talking about our society in particular.
Yeah.
Oh, black people can't get this. Oh, it's not even in Nigeria. There's people who believe strongly that we don't have any cases in Nigeria, and government is just doing this to get money from the WHO. You say you'll be going to work every day. I'm sure you also have colleagues who are working directly with cases. What have you been seeing?
Okay, so I do, it's not relevant here. What I can say authoritatively is that we have cases, and I've interacted with quite a number. We have Nigerians. Initially, we're having mainly foreigners, expatriates, or even Nigerians who are staying abroad and coming back. Now we're seeing cases who didn't travel, who didn't even get in touch with anyone who has traveled. So we know it's in the community. So the issue of black people not getting it obviously has gone through the window. The other issue we're talking about is weather, when weather could allow this to flourish. There is something to be said about the weather. How much of it is a factor, nobody knows. What we have seen so far is that the phenotype, the way the disease is presenting here, is looking slightly different from how it's presenting elsewhere.
Okay.
Whether this is a true reflection, or whether it is the case we're seeing is we're going to see. But what I've seen so far is that the ones we've seen have not presented the way people elsewhere have presented. So maybe the weather has something to do, but it's still early days.
And age-wise as well, because there's a lot of people who believe that younger people don't get this, which is not a Nigerian myth or a Nigerian conversation.
Yeah.
I mean, we've seen all of the data saying, even with the death rate, there'll be fewer deaths under 50 and even fewer under, I think, 35 or 30, I'm not sure.
Yeah.
So the younger you are, the more likely you are to survive. But is that a guarantee of being safe from it? I mean, what is the age range of people you think or that have been infected in Nigeria?
Okay, so that's the thing. I get asked this a lot. There's a difference between risk of getting infected and the risk of getting a severe infection.
Okay.
So everybody has the same risk of getting infected, young or old, same risk. But older people get to have more severe disease. So I have seen a 6-week-old baby get infected. I've seen an 11-year-old, 14-year-old. We have them currently. 16 years old, all ranges. The majority of those who have an infection that we're managing, the commissioner did give some of those studies, so it's out there in the open. But so we have a lot of people in the 30s, 40s having infection. But I mean, it's so they don't have that. It's not too severe.
Yeah.
So so in terms of infection, everybody can have the infection. Anybody can have the infection.
There's a lot of people in Nigeria who believe we might have had this virus in December and January. There's a lot of people who had some severe form of a cold or a flu between December and January. They had a lot of these symptoms, and they believe that probably the wave came then and probably left. Is there any truth to that, you think?
Well, it is one of the theories that could scientifically explain. Like I said, we have not had the severe presentations others have had. So, to backtrack a little bit, we have had people, like you said, elderly people, those who have other conditions may have severe disease. Now we've had people who have had severe disease, who have conditions that you think, this is a bad issue, but they've done quite well. So that is there. Now, the fact that we are not doing too badly would suggest, the question is that, could it be that really we've had it circulating in our communities before we didn't know? We wouldn't know because, we didn't check. I did the truth of the matter. However, with the fact that, people travel a lot, and in truth, if an infection is circulating in Nigeria, you're going to find it circulating in Europe or US in no distant time.
Yeah.
This was not picked there to suggest that, in December, quite a number of people came and went back.
Yes.
So if this was circulating here, there's a possibility, very strong possibility that it's going to be picked up elsewhere and traced back to Nigeria. That has not happened. Yeah. That's one. Two, the fact that all the strains, the species of the virus that have been isolated in Nigerians can be traced back to Europe and China, probably indicates that they came from there, that we don't have anything, because viruses leave what's the word now? Footprints.
Yeah.
You can tell where this virus came from by the sequence. So there's nothing, you can rule it out, but so far we don't have anything to suggest that we had this circulating before now.
So we turn on the TVs every day. We hear ventilators, ventilators, ventilators is the recurring word. Even the Nigerian government has started saying, okay, there was a conversation, I think, with Innocent Motors even saying we were ready to do that as well. I think BUK, yes, also said they were going to try and produce them as well. So ventilators have become very key in the conversation, and everybody in the world is fighting for them. What's the situation in Nigeria right now? I know we don't have that many cases yet that are struggling for ventilators. But the fear is that if it gets there, what's going to happen? Yeah.
So it's so with coronavirus, that's the thing, because most people that do that. So in terms of what we have at the moment, the answer is clear. We don't have enough ventilators, and this, it's that. Now, what this outbreak has done is to show us for what it has shown every system what every system really is. Not only the ability, what you had, but the ability to ramp up responses. And that is what just differentiated China and elsewhere from countries like ours. So with what we have at the moment, you have a few in Lagos, where you have the largest amount of ventilators in the country. The estimates say we don't have enough. Luckily or fortunately for us, like you rightly said, we don't have people who need it yet. If we do get there, it's really, really going to be a big issue. Yeah. And this is probably one of the biggest determinants of survival or not when people do get to that level of this. So it's understandable why there's a lot of discussion around whether ventilators and all that.
Yeah.